is Lily. I did my presentation on Clostridium Difficile, also known as C. diff. This slide is a table of contents. During this presentation, I wanted to go over the etiology of pathological conditions, affected tissues and organs, signs and symptoms, short-term, long-term consequences, and prevention and treatment. C. diff is the inflammation of the colon caused by a bacteria known as Clostridium difficile. In the 1950s, this is where C. diff was identified as a staph infection. In the 1970s, clindamycin was administered by mouth or intravenously to treat the condition. In 1978, it was identified as a pseudomembranous colitis. Then in 81, FDA approved that vancomycin was used as treatment. In 82, Metro was the first line of defense because the low cost and how easily accessible it was. In 84, C. diff was then identified as two separate toxins. There was a toxin A and a toxin B, which affect the body differently. In 96, C. diff grew in number, and in 2000 till today, there has been a large outbreak in our society. Affected tissues and organs. So first we'll start with the kidneys. Dehydration is a result from severe diarrhea, and this contributes to a loss of an excessive amount of fluids and electrolytes. Due to these extreme loss, the body can't function properly and leads to a drop in blood pressure. Dehydration also affects the kidneys, and oftentimes it leads to kidney failures. So with the quick depreciation in fluids, the kidney functions is something that is definitely affected within the body. Furthermore, the toxic megacolon, the colon is incapable of releasing gas among other wastes, which leads to a distended megacolon. Possibly ruptures can happen within the body. The C. diff bacteria can move into the abdominal cavity, which requires emergency surgery and can lead to fatality. GI system, so bowel proliferation could happen. This is known as the hole within the large intestines, which is rare, but it does cause severe damage of the lining. It's just like the megacolon, it ruptures, it causes bacteria to spread throughout the cavity. Again, it can lead to fatality. It is a life-threatening infection. The consequences can be simple as dehydration and as fatal as death. Signs and symptoms. Signs and symptoms are abdominal cramps. It can be short or long. It can be mild, and again, it can be severe. Bloody stools. Bloody stools can definitely happen because of the proliferation and how uneasy it is to break down everything in the bacteria causing proliferation within the bowels. Weight loss, severe weight loss, nausea and vomiting, they all contribute to the dehydration. How quickly, diarrhea happens, how quickly we throw up, any of those things can cause to weight loss, nausea and vomiting. Causes to pseudomembrane formation. We are unable to have any sort of formation within the intestines because of how the bacteria is affecting the colon. Therefore, diarrhea happens. So these are a few signs and symptoms that can occur for C. diff. Short-term and long-term consequences. Short-term effects. Like the signs and symptoms previously stated, the short-term effects are severe diarrhea. Diarrhea can occur up to 10 to 15 days, sometimes even more. Along with severe diarrhea is severe cramping and abdominal pains. Finally, short-term effects may also be an infection if the client isn't well taken care of. Long-term effects. If C. diff manifests and sticks around for a while, longer without any signs of overcoming the condition, toxic megacolon can happen and transpire. Toxic megacolon is a very enlarged and distended colon. In addition to these complications, sepsis may also be brought onto the table and can lead to instability of organ function, including the heart rate. If this disease becomes incurable, C. diff can ultimately lead to death. Prevention and treatment. Prevention, eat thoroughly cooked meats, pasteurized milk, and juices. Also, when serving foods, make sure that they're extremely hot or well cooked. Again, practice good hygiene, as in wash your hands every time. Keep your cooking areas clean, your living areas clean. Treatment, rehydration, electrolyte replacement, and medication. So rehydration and electrolyte replacements are essentially the same thing. Because of diarrhea, we are losing a lot of fluids and electrolytes especially, and we need those things to function because our body is composed of mostly water. And medication, as we've discussed before, there are a few medications there to help treatment. And again, without treatment or prevention, it can lead to deadly effects.